Tonight, new concerns about how fast Oregonians will receive a vaccine. Today, Governor Kate Brown announced that the CDC is cutting Oregon's vaccine allocation by 40% next week. Originally, the state was slated to receive almost 41,000 doses. That number has been cut to about 25,000. Governor Brown said she's seeking answers about the reliability of the data they're getting. And today, Washington Governor Jay Inslee also announced the CDC is cutting that state's vaccine allocation by 40% next week as well.
Monday, we're going to do 3 facilities in the Oregon, and then we'll just keep increasing the amount of facilities that we bring the vaccine.
Seniors will receive the next round of COVID-19 shots in Oregon and Washington. Long-term care facilities will start vaccinating staff and residents next week in Oregon. KATU's Lachey Wesley live in Southwest Portland. Pharmacies will deliver vaccine to the long-term care facilities.
Yes, that is right, and this will be a huge undertaking. There are over 500 facilities in Oregon, and they serve tens of thousands of residents. The first doses of the Pfizer vaccine will be given to senior communities in Oregon next week.
But there's a lot of logistical challenges.
Phil Fogg Jr. is the president and CEO of Marquee Companies. Next week, it will start vaccinating staff and residents at 3 long-term care facilities. With the Pfizer shot, nurses and doctors will have 6 hours to vaccinate up to 250 residents at one facility.
You've got to have all the paperwork done, the consents, all the information for reporting to CDC. All of that has to be done before you get there. So when you get there, you can just focus on the vaccination process. It's very unlike what you and I experience when we go in for our annual flu vaccine.
The state hasn't provided a timeline for how long this phase will take. The Oregon Healthcare Association, which advocates for quality long-term care, tells KATU News in a statement, "We are hopeful that most of the long-term care workforce and residents will be vaccinated by March 1st, ideally, or early spring." Fogg expects a similar timeline.
Call it the end of February that we feel like we'll have our facilities done. I think that to vaccinate the entire long-term care population in the state of Oregon, you're probably looking to the end of May before everybody gets vaccinated.
Now, this timeline is entirely dependent on the supply of the vaccine and whether or not U.S. regulators approve other vaccine candidates. Live in Southwest Portland, Lachey Wesley, KATU News.